is Hannah Myler, and today I'm going to be presenting on the intergenerational transmission of trauma. So essentially what that is transmitting trauma from generation to generation. In the example of a parent and a child, let's say a parent lived through an experience in the Holocaust, and then they were to transmit that trauma onto their child, even though their child wasn't in the Holocaust as well. And so it's basically transferring lived experience to somebody, even though they haven't lived the experience. And I'm specifically going to be emphasizing from parent to child, transmitting the trauma. So to begin, I began by looking at a research study done of a Holocaust survivor and her two daughters. And so they specifically were researching the daughters to see if any of the mother's trauma had been passed on. And the way they conducted this study was by having the two girls complete an ink blot test, which is essentially looking at this ink blot and through a series of questions, guided questions, being able to kind of interpret different thoughts and feelings that they have and come up with what they see in the ink blot. And so it does have a scale, it's called the Woosom scale. And through the Woosom scale, they were able to identify that in these two daughters, one of them had a lack of associations. And so to talk a little bit more about that, the lack of associations, it says her stream of associations comes from the world of the Holocaust and evil, as if the experience of her mother turned into her own. And so I just thought that was so crazy that her thinking disorder of a lack of associations, she couldn't disassociate, that was my mom's experience. She actually internalized her mother's trauma, as did the other sister. The other sister, she quoted, "Sometimes it's even harder to be the victim of a victim than the victim of a hangman," implying that she believes her experience was more difficult than her mother's in the Holocaust, just kind of internalizing that trauma. So I thought that was really deep. As I went on to study more, I stumbled across a study by Dr. Rachel Yehuda, who studied, there were 32 participants, they were Holocaust survivors and their children, and so they did some testing on the children and were able to discover lots about how biologically not our genes can change, but a marker on our genes change if our parents have lived trauma. So stay tuned to learn a little bit about this from Dr. Rachel Yehuda.
Dr. Rachel Yehuda, director of Mount Sinai's Traumatic Stress Studies Division, led the study. Her team interviewed and drew blood from 32 sets of survivors and their children, focusing on a gene called FKBP5.
We already know that this is a gene that contributes to risk for depression and post-traumatic stress disorder.
Yehuda noticed a pattern among the Holocaust survivors called an epigenetic change. Not a change in the gene itself, but rather a change in a chemical marker attached to it.
And when we looked at their own children, their children also had an epigenetic change in the same spot on a stress-related gene.
What does that suggest?
Well, in the first generation, in the Holocaust survivor, it suggests that there has been an adaptation or a response to a horrendous environmental event. And in the second generation, it suggests that there has also been a response of the offspring to this parental trauma.
Which means children of Holocaust survivors like Sonneberg could be more likely to develop stress or anxiety disorders. Though their study was small, Yehuda and her team controlled for any early trauma the survivors' children may have experienced themselves.
How is it that a parent who was subjected to the trauma of the Holocaust is able to somehow transmit that to a child who wasn't there?
Oh, that's a really good question. And this study that we did doesn't address the how. The study that we did just provides a proof of concept that we might be able to identify the how if we do more research.
DNA is passed from parents to children, but research like Yehuda's suggests parental life experiences can modify their body chemistry, and those modifications can be transmitted to children as well. Scientists...
Alright, so I thought that was extremely interesting to see that a change in the chemical marker on the gene was there in children of Holocaust survivors. So that means that internally, biologically, there are changes happening. And so now I want to take a look a little bit more more into the clinical aspect of this topic and
59-year-old Karen's
look at how, look at a different study that focuses a little bit more on the clinical. So this study talks about the transmission of early maladaptive schemas from mother to child. This study was conducted through a series of interviews and questionnaires on mother-children sets, and was able to conclude that when a mother has maladaptive beliefs about her own relationships and worthiness in the world, she can pass those down to her child. And so I chose this image of a woman in a mirror. If a woman is to say things often like, "I'm so ugly," she can transmit that to her child. That's like a maladaptive schema mindset that the child can then inherit. And so how do we break this cycle? Clinically, as future therapists, how do we break this cycle? I believe that the way to do this, as it mentions in the study, is to obtain early interventions for the children. So if their parents have lived through trauma, making sure to put the child into therapy at a young age, knowing that trauma can be transmitted from generation to generation. All these interventions should emphasize positive parent-child relationships to prevent transmission of maladaptive schemas. And so you're promoting parent-child relationships, you're getting them into some kind of therapy from a young age, and the study ultimately did conclude that you can transfer maladaptive schemas as well as trauma. And so now we're going to hear from another professional therapist who gives input on how clinically we can intervene.
If you can help a mother think about what feelings she's having that are so hard for her to control, help her calm down, help her tolerate distress, and then help her think about what might actually be going on in her child, that helps enormously to sort of break the cycle of transmission there.
So to break that cycle of transmission, we help mothers to kind of put themselves in the world of the child, get them into therapy, see what's going on with the child. Clinically, there's a lot we can do if we intervene early to stop this trauma from being transmitted. Thank you all for listening to my presentation, and I hope you're able to learn lots.